Happy Saturday, everybody, and happy Father's Day weekend for those of you celebrating. Today I want to talk about muscle repair. That's something that I get a lot of questions about, and I'm going to give you a little tip on how to know if you need muscle repair. So, who needs muscle repair? Muscle repair is an important part of a tummy tuck, and patients who've been pregnant are often going to need muscle repair. Patients who've been pregnant and had a C-section or any other prior abdominal surgery may also have separation of the muscles, and they will often need a muscle repair. Now and then there are patients who've never been pregnant but simply have a large amount of weight, and those patients often need muscle repair. The other category of people who may need muscle repair are those with large hernias, and part of a hernia repair involves putting the muscles back where they belong as well. So how can you tell by looking in the mirror if you need a muscle repair? Well, I like to look for what I call the parenthesis sign, and that is going to be the shape of the rectus muscles of the abdomen, which are normally together, either parallel or in a V shape, like in the picture I'm going to show you. They will become a parenthesis shape, or even what I call a bracket shape, as they separate with pregnancy. Now, a lot of patients think that the muscles themselves are actually the problem, but they're not. It's the fascia, or the lining of the muscle, that actually stretches in response to the hormones of pregnancy, and that's what we actually repair. In most cases, stitches are used. They can be permanent or they can be absorbable. They're going to pull the muscles together and not only make them come closer together, but also rearrange them in a more cosmetically pleasing shape. How do we figure out what's cosmetically pleasing? Well, you've got to go look at a bunch of bikini models. That's part of my job, to find out what a pleasing abdomen looks like. So we generally want the parenthesis shape to go into a V shape or a parallel shape. And I'm going to show some pictures that show that here in a minute. How is a muscle repair done? Well, every surgeon has their own special technique, and in my experience, every muscle repair is customized. Every person has a different deformity or a different laxity of the abdominal muscles, so every patient's repair is really going to depend on what's wrong with the muscles and where they are, the way I find them. Also, the repair is going to be dictated on whether or not a patient has a ventral hernia, an incisional hernia, or an umbilical hernia, and that's going to change the way we do the muscle repair a little bit. What about the recovery and downtime after muscle repair? Well, muscle repair, for those of you that have had it, know it's the most painful part of abdominoplasty or a body lift. The muscles are very sensitive, and that's going to cause an abdominal pain all the way from the top of the abdomen, lower chest wall, all the way down. So there's often a lot of discomfort from that. It's very important to address whether or not the patient's having muscle spasm after surgery, because that won't be helped by narcotic medication, so it's important to treat muscle spasm. A numbing catheter, which is what I choose to use, really helps with pain control afterwards, and just limitation of movement, having an assist getting up, using your arms and legs rather than your core muscles are other important parts in the immediate recovery of a tummy tuck. What about return to activity? Well, I ultimately let patients do whatever they want, even very vigorous activities like jiu-jitsu, boot camp, wrestling, parasailing, all kinds of things. That's all possible, but I really make patients wait, in my experience, between 4 to 6 months before I let them go back to full, heavy activity. I certainly will let them use their abdominal muscles after 1 month. I let most patients drive at about 2 weeks. But it's very important to avoid direct abdominal exercises, in my opinion, for the first 3 months. That means things like crunches or hardcore planks or heavy lifting that involves the abdominal or core muscles. I try to get patients to stay away from doing that for about 3 months, and I really don't let them go back to very heavy activity until 6 months. The good news about a muscle repair is you don't have to do crunches and you don't have to do heavy-duty abdominal exercises to keep those muscles back together. You just have to not get pregnant and not gain weight again. So I think that's doable. Thanks for listening. Put your comments below, and always happy to be part of the group. Have a good day.